Hi everyone, and welcome to another episode of the Fibroid Doc, where I am committed to helping women with fibroids live a life with reduced bleeding and pain and improved fertility. So today I am so excited to tackle this topic of weight loss and fibroids. One of the most common questions I get is, am I going to lose weight when I remove these fibroids? Or am I going to lose weight when I have this hysterectomy for fibroids? And so I wanted to tackle this question in a little bit more detail. And I think you would be surprised to find out that fibroids actually don't weigh all that much. And it can get a little confusing because doctors may often talk about fibroids in terms of size. Okay, 5 centimeters, 6 centimeters, 7 centimeters, and we're used to, in the US, mostly talking in inches. So first of all, that's a little confusing. And then we also talk in grams. So when you see your pathology report, you may see, that your fibroid weighed 65 grams or 100 grams. Like, what does that mean? Because we are used to talking in pounds. So I wanted to first just go over, for reference, a couple of common household things that we all know, and that we can use to think about the size of our fibroids. Okay, so an apple, for example, weighs about anywhere between like 50 to 80 grams. Okay. And a normal uterus without fibroids weighs about 60 grams. So if you think about it, the size of a uterus is more or less the average weight of an apple. Okay, the weight of a uterus is about the weight of an apple. Now, a pineapple weighs about 1 kilogram or 1,000 grams. Okay, 1,000 grams equals a pineapple or like a bag of flour at home. So that's pretty heavy, okay? And when we talk about fibroid removal, I just looked up the last 5 weights of fibroids that are removed, and they are anywhere between 56 grams and 1,079 grams, okay? So anywhere between the size of an apple to the size of a pineapple, or I should say the weight of an apple to the weight of a pineapple. So clearly, if you have fibroids that weigh as much as a pineapple, sure, you may lose some weight. And to be very technical, 1 kilogram equals 2.2 pounds. Okay, so you may lose a little bit of weight. So if you are 150 pounds, okay, you're gonna go down to 148 approximately. So that's a little bit, but it's not a lot. A lot of patients, when they talk to me about fibroid removal, they think, oh my goodness, I'm going to lose like 10 pounds. I'm going to lose 15 pounds. And that's actually not true. Okay, so on the heavier side, you are losing a pineapple from your belly. And on the lighter side, you're losing about an apple. And a common rule of thumb to just think about is 5 centimeters equals an apple. Okay, so if your fibroid is 5 centimeters, that's about the size of an apple. So you're losing a little bit, but not really a ton. Okay, the heaviest I think fibroid that I've removed was about 3 kilograms. Okay, that's 3,000 grams, and that is almost 6.5, 7 pounds. So that's like a size of a baby. Okay, so for that patient, yes, she lost about 6.5, 7 pounds. And that's, a noticeable weight change. But for most of us, when we undergo a myomectomy or fibroid removal, we're losing, again, anywhere from the size of an apple to the size of a pineapple if you really have large fibroids. So the first point to remember is a myomectomy is not a weight loss surgery. Okay, so you are getting a myomectomy or fibroid removal for the symptoms that it's causing you, but it's not really going to cause you to lose a lot of weight. That's the first thing to remember. The second point is it may change how you feel. Okay, so despite these fibroids not really weighing a lot, they can definitely put out little chemicals that cause bloating, cramping, pain, and they may be impacting your uterus in such a way that it's causing bleeding. So even though weight-wise, you're not really taking a lot, feeling-wise, you may improve a lot based on the symptoms that this fibroid was causing you. Okay, so that's point number 2. And point number 3 is the fibroid may actually change, removing a fibroid may actually change how your lower abdomen looks. So sometimes I'll remove a fibroid and then patients will say, oh, I have this like loose like skin around my lower belly. And that could be because after years of stretching your skin, now when I remove the fibroid, that skin is hanging a little bit loose. And that's very much like having a baby, right? When you have a baby, your skin stretches, your belly becomes really large. And then after the baby's born, you have this extra skin. So that can happen. Okay, but in terms of actual pounds lost, you may not experience a significant change in weight. Okay, so hopefully this has been helpful to you in terms of thinking about fibroids and weight and size. So when you speak to your physician about, your ultrasound report or your MRI report and you're seeing all these sizes and weights, you can sort of put a couple of things together and help it make a little more sense to you. Okay, so just remember 5 centimeter fibroid is approximately the size of an apple. Okay, and large fibroids are about 10 centimeters, or they can even be 15 centimeters. So that keeps going up in weight. And a pineapple is about 1,000 grams, or 1 kilogram, or 2.2 pounds, okay? But the average fibroid, the more common ones that we're discussing, are about anywhere between 5 and 10 centimeters. So anywhere between the size of like an apple and maybe a grapefruit, okay? So really quick, 3 main points. Number 1, myomectomy is not a weight loss surgery. Number 2, a myomectomy can definitely change how you feel despite not losing a lot of weight. And number 3, removing fibroids, it can definitely change how your lower abdomen looks in terms of excess skin. Okay, hopefully this has been helpful. If you have found this useful, please subscribe to my YouTube channel and share or tag a friend who will also find this information useful. Until next time, bye.